Hi everyone. So we're going to talk about universal precautions and how they are used in community birth settings. So universal precautions, the CDC recommends that you take precautions anytime you're dealing with blood or body fluids, no matter the infection status of the patient. So anytime you're handling or potentially handling blood or body fluids, you should take precautions. And that includes things such as gloves, gowns, protective eyewear, and masks, and a barrier for mouthpieces when you do resuscitation. So in community birth settings, in my experience, gowns and protective eyewear are not routinely used, but everything else is. So gloving is very important to use anytime you're handling any type of body fluid, collecting blood, assisting with delivery, handling the newborn, changing bloody sheets or towels or Chucks pads, anything where you may come in contact with body fluid or handling that newborn, you should wear gloves. And anytime you get any blood or body fluids on your skin, you should immediately wash your hands. And hand washing is the first part of universal precautions. Adequate hand washing. Another part of universal precautions is placing all sharps and needles into a sharps container so that there's no risk of anyone touching a contaminated needle or any sharp objects. And universal precautions is different from sterile technique. Sterile technique has to do with you use sterile gloves and you put them on in a certain way where you do not touch the sterile glove, and you can only touch things that are sterile when you have them on. And if you break that sterile field, you have to remove the gloves and put new ones on. So when sterile field, you sterile gloves, only touching sterile items such as sutures, sterile equipment, etc. And universal precautions, aside from sterile technique, would just be your standard gloving, masking, barrier for resuscitation, etc.